Hello everyone, my name is Matt Klein, and for my presentation, I will be discussing Australian Aboriginals and their increased risk due to COVID-19. I decided to choose this topic because as an urban Indigenous citizen of Canada, I understand and have experienced some of the shortcomings that Indigenous peoples of Canada face and wanted to examine the shortcomings of other Indigenous populations. Now, I understand and recognize that I could have focused on the entire culture, but I think it's important to develop an understanding of pressing current events to fully understand the effects of colonization. That being said, we will of course be diving into colonialism, the ways of life of Australian Aboriginals because of colonialism, their health during the COVID-19 pandemic, and the lingering effects of the socioeconomic inequalities. Now, let's get started with the presentation. Before we get started, I would like to clarify some definitions to avoid any misunderstandings. An Indigenous population is relating to the earliest known inhabitants of a place that was colonized by a now dominant group. For context, the Indigenous population are the Australian Aboriginals, and the now dominant group are the British, who colonized the island in 1788. You will notice that I use Aboriginal and Indigenous interchangeably. Colonialism is control by one power over a dependent area of people, and urban Indigenous peoples are those that live off their reserve and in cities, towns, villages, etc. While I will be presenting a vast amount of information today, there are four main outcomes that I intend for you to take away. These are as follows. While the Australian government has implemented public health measures to end the COVID-19 pandemic, it is difficult for many Australian Aboriginals to follow these measures to the fullest extent. Life was not perfect for the Australian Aboriginals before the pandemic started. These inequalities have been lingering around for years, and the government's response is unsatisfactory. The COVID-19 pandemic has heightened the inequalities that the Australian Aboriginal population faces, and the end of the pandemic does not mean a resolution of inequalities for Australian Aboriginal populations. These issues still exist and need to be reconciled, as it is a government's responsibility to maintain the quality of life for every citizen, regardless of race. The British colonized Australia in 1788, where there was an estimated Aboriginal population from 300,000 to 750,000 people. The number is so broad because there's so many inconsistent records regarding such. What we do know is that the population drastically dropped to 75,000 people by the 1920s. This was mainly due to substance abuse and diseases introduced by the colonists. While experts still debate this number, it is estimated that 20,000 of those that died were murdered by colonists. The British government's goal was to assimilate the entire Aboriginal population. In 1820, the government claimed those that were fully Aboriginal were not possible to assimilate and were therefore doomed to extinction. Those with mixed heritage were seen as worth saving and were forced to assimilate into British mainstream culture. It wasn't until World War II that the government saw all Aboriginals, regardless of a descent, were possible to assimilate. They still had a tight restriction on their civil rights, mainly because the government saw them as incapable of making their own decisions. Those that were assimilated are regarded as the stolen generations. Near the end of the 20th century, Indigenous rights were recognized and the government started to work towards reconciliation. The word reconciliation, however, was open to interpretation. This is because right-wing politicians wanted to maintain the socioeconomic advantage the government had over Indigenous peoples and wanted to keep some barriers in place, while left-wing politicians wanted all people to be seen as equal no matter the consequence, which is what it should be seen as. Therefore, today, there's still an imbalance in power for the Indigenous peoples in Australia. This is where I will be moving on to next, the socioeconomic inequalities Australian Aboriginals faced. Even though the government has introduced new policies to reconcile the stolen generations, there has still been little progress made. This is mainly because of the cultural subjectification that the mainstream white culture still has towards Aboriginals, ultimately making it near impossible for Aboriginals to achieve social mobility. This culture stigma still stands today because people are often inspired by their own ideas, not the government's, which pressures many to remove cultural stigma. As unfortunate as it is, policy change, education, and efforts for reconciliation are simply not enough. Many Euro-Australians still see themselves as inferior to the Aboriginal population and want to make their opinion known through racism. Part of these assumptions are reinforced by the government, as they still own a significant portion of Aboriginal land. Many Indigenous elders have been demanding for years that their land be rightfully returned to them, with the promise that it won't be stolen again. This relates to the right-winged idea that removing all barriers to equality also removes the socioeconomic advantage the government has over Indigenous peoples. The idea has also been introduced that Aboriginal peoples are figuratively subjects of the state. This is because modern-day society still revolves around capitalism, and all workers are subject to capitalism. Many Aboriginals affected by capitalism can be considered subjects to the economy. This illustrates the idea that the economy controls the lives of Indigenous peoples. To allude to the idea that Australian Aboriginals are at a heightened risk of suffering severe consequences from COVID-19, I want to bring forward an illustration of the Aboriginal population's health status. Before I dive in, I want to outline the results from a survey the Australian government conducted in 2019. This survey focused on the Aboriginal population's health status. 46% of Aboriginal peoples have at least suffered from one chronic health condition. 30% of the population suffers from mental health conditions, and 37% of children are overweight or obese. These numbers are growing, as demonstrated by the significant growth in numbers from the last survey completed in 2013. It is also recognized that the growing numbers are mostly from those living in remote areas, as there is little access to proper health care than those living in non-remote areas. In addition, more than half the Indigenous population are at risk at developing substance abuse issues, causing further complications. Additionally, 89% of Aboriginals aged 15 and over have poor physical activity habits. This poses a risk for many health conditions, both physically and mentally. Based on these numbers, it is evident enough that the government has failed the Indigenous population in supplying them with adequate resources to live in a healthy lifestyle. The government also failed to allocate proper resources to prevent and maintain chronic conditions. Now that we understand the roots of colonialism, how they still prevailed pre-pandemic, and the health and socioeconomic inequalities of Aboriginals, I want to move on to the heightened inequalities during the COVID-19 pandemic. Simply put, the health and socioeconomic inequalities put the Australian Aboriginal population at risk of contracting COVID-19. This is because it is nearly impossible for those living in remote areas to take every precaution to evade COVID-19, like we still are able to today. These measures include proper hand washing, physical distancing, and self-isolation. While it is easier for us to take these preventative measures, there are so many factors that prevent the Australian Aboriginals living in remote areas to take these measures. We've all heard this phrase so many times since March 2020. Wash your hands with warm, soapy water for at least 20 seconds. But how do you do this without access to clean water or even enough soap to support a proper hand washing regimen? This is the exact problem that remote Indigenous communities face today. There have been little efforts to provide remote communities with access to clean drinking water leading up to the pandemic, that there just isn't enough clean drinking water. Another common phrase that has been expressed to us is to physically distance from each other by 6 feet or 2 meters. But how do you do this in a self-sufficient community where their economy runs based on transactions in and out of communities? I'm still trying to find the answer to this question myself. While we are told to self-isolate because we are either a close contact of someone with or we have contracted COVID-19, it is fairly easy for most of us to do so. But how can one do such in a household with multiple generations sharing the same or less amount of space that many single families in Canada live in today? The sad answer, there just isn't. As mentioned earlier, Aboriginals are at an increased risk with various health problems. This is the target of the COVID-19 virus, where those in poor health are forced to take even more precautions in evading COVID-19. Again, I want to reiterate that a lot of these are preventable with the necessary supports, but cannot be achieved by the Indigenous population alone. Fortunately, as most of us have heard, Australia has isolated itself and has almost eradicated COVID-19 in the country. This is a huge sign of hope for the Australian Aboriginals. But as Australia heads into the pandemic recovery, more needs to be done in supporting Indigenous populations to prepare remote communities for another pandemic to hit. The pandemic recovery is a challenge globally. While I discuss this, I want you to keep this question in mind. How can the Australian government take advantage of the pandemic recovery as a means of reconciliation for Indigenous populations? Travel in and out of remote communities is extremely difficult and pose a challenge to remote communities in accessing proper healthcare if a person is infected with COVID-19. Indigenous communities and the Australian government are faced with a challenge on how to establish effective and proper modes of easily accessing remote communities for equal access to proper food, essential resources, and healthcare. Many communities faced outbreaks because of the constant travel in and out of communities for the purpose of work. This is the main explanation why COVID-19 outbreaks occurred. The situation would have drastically changed had communities been able to support themselves by working within the community. Overall, these two issues are the main ones that the government needs to focus on in the pandemic recovery to help reconcile the stolen generations. For the government to not take advantage of the pandemic recovery would be senseless due to their alluded lack of effort to equalize Indigenous populations with the Euro-Australians. I've included some additional resources to help aid in the understanding of the effects of colonization. These resources focus on the assimilation of Indigenous peoples, but awareness of this issue is an important step for reconciliation. Rabbit Proof Fence is a movie that takes place in 1930s and follows the stories of mainly 3 Aboriginal girls that watched their families be torn apart and forced into assimilation. It was this movie that inspired me to explore this topic for my lecture. Indian Horse is a movie that does not actually focus on Australia, but rather the Indian residential school system in Canada. I think it's an important movie to watch because it shows the domestic impact of colonization in Canada. Dark Emu by Bruce Pascoe is a nonfiction book that focuses on the accounts of Australian Aboriginals before the British made contact with Australia. This book illustrates their self-sustaining lifestyle and their abilities to live a healthy and fulfilling lifestyle before contact was made. Catching Teller Crow is a fictional story based on the real accounts of Australian Aboriginals. This book provides an understanding of the colonial history of Australia that can aid in the understanding of the actions committed by the British. These next 2 slides are my references. I would like to thank you for listening to my lecture, and I hope this aided in your understanding of the effects of colonialism in other countries. I think it's important that we obtain the knowledge of colonialism in other areas of the world and its reflection on Indigenous populations. I hope that you were able to make connections back to Canada and their colonial routes, as they are similar to a certain degree. I encourage all of you to research other Indigenous populations of the world and their effect on colonialism.